go through the objectives for today. So we have two objectives for today. I really hope this can be useful for you all. One, in helping you understand how different types of evidence can inform the selection and implementation of peer-led interventions. And then secondly, to learn how to use evaluation to promote the quality, reach, and sustainability of peer-led interventions. So both selection and then improvement of whatever interventions you guys are doing. And so I have material on how to do evaluation, and then at the end, we might have some time to, talk some about evaluations you all are working on. So, if you want to think about as I go through this material, how to answer the questions and issues that I'm talking about in the context of your own work. And then I'd really love to hear from you all in terms of what you're doing, what you're thinking about in terms of evaluation, and how you might use the evaluation work that you're considering. And it'd be great to talk about that, and then I'd be happy to help you think through what might work best in your own situation. So any questions before I get started? Okay. So, I sprinkled in a few dad jokes here, and I'll open with one on evaluation. So, who can tell me why the underwear evaluation finished ahead of schedule? Anybody want to make a guess? It's because they were studying briefs. So
good one.
I'm here all day, folks. No, just for the next. You guys are just stuck with me for the next hour. Okay, so in thinking about evaluation and why it's important, to me, it helps to think about the medical system and like what the world of prescription drugs would look like if there was no need to rigorously evaluate their safety and efficacy. I mean, you can imagine it would be very hard to identify safe and effective medications with all the incentives to just market whatever can be sold. And so, of course, evaluation and randomized trials plays a really important role within the medical system, but it's of course, very important in many other fields as well. Psychology, public health, sociology, education. It really provides a wealth of knowledge about what works and how we can make things better. And, of course, a lot of peer-led interventions aren't conceived or created through evaluation work, but nonetheless can benefit from it. And, currently there's a lot of evaluation research that helps us know what works in terms of promoting mental health and preventing substance use. And of course, there's lots more that needs to be done. And so this is an effort to help you guys think through how to use evaluation research in your own work. So one thing that I think is really helpful is just knowing the existing evidence. There have been a number of strategies identified that do work. And I mean, really the most straightforward way to promote mental health or recovery from addiction is just by using what we already know works. So for example, Alcoholics Anonymous, that's been rigorously evaluated. We know that works. And I think it'd be great if we invested more in getting more people involved in those groups. Now, that said, not everything has been evaluated. There's lots of stuff going on that may or may not work to varying degrees. a lot of the times what we already know works doesn't necessarily meet the existing community needs, and so something else is needed. And it's also not realistic to expect everything we do to be backed by rigorous evidence. But nonetheless, I think it's helpful to know the existing evidence related to peer-led interventions. And it's also helpful to keep in mind that sometimes interventions that sound good and are well liked don't always work. And sometimes they can even be counterproductive. So for example, in the field of delinquency and substance use prevention, they were doing something called, well, one that comes to mind is called Scared Straight, where you take kids and take them to a prison, and the prisoner, talks to them about how horrible prison is, and the intention is to scare the youth straight so that they don't go down that road. And that has some negative consequences to it that they identified through evaluation research. And, usually what we're doing isn't harmful, but might be not helpful either. And so we can use evaluation to kind of parse what's really making a difference versus what maybe sounds good but isn't really helping. All right, so if you want to pursue evaluation work, you want to first think about what your goals are for the evaluation. And there's two main kinds that I think are helpful to differentiate between. One is outcome evaluation. So that's really asking the question of whether what you're doing works on some pre-specified outcome that you want to target, whether it's mental health or something else. And then there's other more process informative kinds of evaluation, which really look more at the details of what's going on and is it being implemented well? How can we do it better? So it's less focused on that yes, no, is it working? And more focused on how we can do it better and whether we're doing what we plan to do. And so in the context of outcome evaluation, I think the less you have a sense of whether what you're doing is working, the more outcome evaluation is warranted. Whereas if you're doing something that already has a strong evidence base, outcome evaluation is less needed. And I think in all cases, the process informative evaluation work can be really helpful. And we'll talk more about why that's the case. Okay, so this is my informal approximation of varying levels of rigor for outcome evaluation work. We're looking to see if a particular intervention is reaching or helping people in the way you hope it is. So the most simplistic strategy for looking at outcomes, and by the way, this is from a quantitative perspective. I'll also talk some about qualitative methods, but this would be using statistics and closed-ended survey questions most likely. But so you could do post-test only, where you look at just after the fact, you ask people if the intervention was helpful. So like a satisfaction survey following a training that you're doing, or a group of some kind that you're running. So that would be like the lowest level in terms of rigor. Of course, it still can be very helpful. I don't mean to say it can't be helpful, because you can learn a lot from just doing satisfaction surveys and getting a sense of what people liked and didn't like about the group. But in terms of proving beyond a reasonable doubt that your intervention is working or not, typically the post-test only isn't rigorous enough. So if you want to take a step up from there, you can do a pre-test and a post-test. So that's Like, for example, you could measure people's levels of stress before they go to a self-help support group, and then measure their levels of stress afterwards. And if you saw a decrease, you could think, well, so it seems like we're making a difference. We're seeing stress levels are decreasing, and so that's very encouraging. So that's definitely more rigorous. And to further create a compelling outcome evaluation, you could add long-term follow-up, such as a 12-month follow-up where you're examining, you could examine both short-term and long-term outcomes. So, if you have a training, you could look, you could do a pre-test on peer support skills and a post-test on peer support skills. And that would be sort of like a short-term outcome, but then, do those improved peer support skills lead to better relationships longer term. So you could look and see, at 12 months, were relationships better than they were at baseline? And with the idea being that by improving peer support skills, we would improve relationships as well. But there's different ways of thinking through that. But you have short-term and long-term outcomes, and with that long-term follow-up, you can kind of get a better sense of what the group or training is doing in a long-term kind of situation. And of course, the work that we do, we hope it has a long-term impact on people, so that can improve the rigor. And then to take a step up from there is to add a comparison group that isn't exposed to the training or intervention that you're interested in. And what that does is, like, here you're following the people that are getting it over time, and are they differing in some way, like on mental health? If the people getting the intervention, their mental health is going up, and then the people not getting in the intervention, their mental health is staying flat, that's further evidence that your intervention is doing something that's not happening to the rest of the population. And this is really
Louis, would you
Yes.
do you regard the wait list situation as a form of a comparison group?
Absolutely, yeah.
Okay.
Yeah, so we're doing, as an example, a wait list is if there's high demand. For example, I'm working with Share on training of their peer kit, and we're using a waitlist control design where several hundred people express interest in getting this training, and because of limited training capacity, we take the first couple hundred people and put them through the intervention first and track outcomes for both the people that got the intervention first and those that got it later. And then, we reassess after one group has gotten the training and before the other group has gotten the training. And then we let the waitlist group get the training. And then after both groups have gotten the training, you would expect them all to be equal, but there is that moment in time where they are in fact different. And so you can look to see if there's differences between those groups. So the comparison group is a really handy way of improving causal inference, the cause of, like, this intervention causes mental health to get better. And the reason is because there's outside factors that can impact whether people's mental health gets better or worse. So let's say COVID hits and everyone's mental health gets worse. Well, that wasn't because of the intervention or not. That was because of this external factor that impacted both groups. Similarly, like with prevention work, it's really important because, if you're trying to prevent the uptake of alcohol use with youth, And you just follow them pre-post 12 months and you see, oh, look, there was no change in alcohol use amongst the youth. If you had a comparison group, you would likely see that you actually succeeded, because as youth get older, they just, like, rates of use increase as you move through the grades of high school and middle school. And so you would see in the comparison group the rates of use are going up, and look, in our intervention group, the rates of use were flat, and that's actually a success that you might not otherwise notice. Okay, and so finally, level 5 is the use of random assignment. So you've probably heard of, like, randomized clinical trials, and this is it's a way of creating a comparison group that's more rigorous than just picking two groups you think are roughly equal. And the reason, so what you're doing here is, like in the waitlist control design, we take the 300 people that are interested in getting trained, and randomly we pick and put some in, you're going to get it first versus later. And because it's completely random as to whether you're in the getting the intervention first or getting on the wait list, you create two groups that are statistically equal. So even though no single individual is going to be, the exact same age or racial background or composite of, different background characteristics that might impact the success of the intervention, as a group, the two groups should be statistically equivalent for both measured and unmeasured background characteristics. And so the random assignment is a really powerful and important way of improving causal inference when you're doing outcome evaluation. Okay, so I wanted to talk a little bit about comparison groups. So I mentioned you're trying to find that comparable group, and random assignment's not always possible. I think if you're doing an evaluation and random assignment's not possible, you still might be able to find a comparison group. And one way of doing this is by, there's various established surveys that are out there that are monitoring the nation or a state, and they will have various questions assessing mental health or substance use. And so you can look at, like, how national rates are tracking on mental health and substance use, and you can pull questions from those surveys and ask them of your intervention group. And if you see changes in your intervention group that aren't reflected in the general population, that is, to me, quite a bit more convincing than just you tracked just your group over time. And there's a number of places you can pull data from. SAMHSA has the National Survey on Drug Use and Health. There's you can get census county profiles that have some interesting data. HRSA has some data, and the Robert Wood Johnson Foundation has county health rankings. There might be data available locally as well that can be of interest. So it's, if you're trying to do an outcome evaluation and you can't do random assignment, you might consider this strategy of comparing your intervention on measures that are available elsewhere. Okay, so I also wanted to touch on logic models. This is really helpful for outcome, or both for outcome evaluation and intervention development in general. I think it's just really helpful to think through the logic of your training or your group and why it's supposed to be successful. So you can think of the logic model as a series of if-then statements. So you have certain resources or inputs that you need to do a training or group, and if you have them, then you can do particular activities. And if you, take people through these training activities, then you would expect that, if your recruitment's successful, you would deliver services as intended, and reach a certain number of people with your training or your group. And then if they go through your group, you would expect certain outcomes. And you can think about both short-term and long-term outcomes. And that can be really helpful, like what's immediately going to happen, and then down the road, what you might hope happens in terms of your results. And so that just, thinking through that tells you, like, okay, well, if we want to see if we're doing a good job. Sorry about that, guys. I don't know if you can hear that, but over here, you're looking at if, are we doing things the way we expect? And then over here, you're looking at, are we really getting the outcomes that we expect? And both can be really helpful to monitor. Oh, and I almost forgot, I have a logic model joke for you all. So why did the dog keep smelling the logic model? It's because it made such good sense. Couldn't resist. Okay, so that's logic models. And I would encourage you to think through the logic model, think through your outcomes, hopefully it'll make good sense to everyone involved. And from there, you have to pick measures. So you have your short-term and long-term outcomes identified, and you want to select measures that are practical, but also hopefully have some established validity. So it's best to avoid making up your own measures and rather pull stuff from the existing literature that's shown to have some validity, just because measurement's tricky, and if you make it up on your own, then the burden is on you to show that you're actually measuring what you think you are. Whereas if you're pulling from something that's already established, you can kind of rely on that past work. Okay, last joke, guys. This is so I'm going to talk some about qualitative evaluation. And so in what scientific field did the koala win an award for distinguished scientific contributions?
Qualitative research.
Ding, 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 ding. All right, you guys are on. Okay, so qualitative data is really helpful, and I think it takes less technical skill than quantitative research does sometimes. I mean, certainly qualitative work can get very technical, but you can do good qualitative work with less, statistical knowledge and that kind of thing. So sometimes this is an easier entry point for evaluation work, and it's still very powerful. So that might be observations, can be interviews, you can do focus groups. And typically this would be done with the participants in the training or group, or people that are implementing the training or group. And, both those perspectives are very different, but very powerful. Thomasina, did you want to? Yes.
Yeah, I want to ask, I went to the Survivors Research Network in UK, they're meeting today, and these are peers who do their own research, and so I wanted to ask you, how would you bring in peers, like, for example, in the qualitative evaluation, participatory action research, or involving the peers in actually designing the research?
Yeah. Well, so I think certainly whatever, when you're making decisions about how to do evaluation, you want to engage, but you want to engage some people that can be participants. You want to engage the people that are going to do the implementation. And, throughout all phases of the decision-making process for putting together an evaluation, I think, the more you can do that collaboratively and make decisions as a team about what's going to be most useful is best. I guess the counterweight to that is like the more perspectives and people you engage, the longer it's going to take to make decisions. And so at some point you have to balance need for efficiency with need for bringing in multiple voices and perspectives. And of course, you also have to find people that are willing to put the time in to think through all these issues. So, I don't think you want to just burn everyone out thinking through every single detail of evaluation. So you have to strike a balance, but certainly, community engagement and stakeholder engagement and engagement of peer researchers is really important for this kind of work. Okay, so a little bit more about qualitative evaluation. It can really be helpful in terms of informing program adjustments to improve implementation quality of groups and trainings. And the qualitative data is also really helpful for storytelling about the impact. So you can use that data to share with stakeholders and other groups that want to get buy-in from, to talk powerfully about how this program or training is helpful to people, and that can help both with recruitment and getting people's interest to get them involved, but then also if you need more resources, you can use those stories to help potential funders understand the benefits of what you're doing. Okay, so I wanted to just give some highlights or high-level tips on developing interview guides. And Thomasina, feel free to chime in with your own ideas here. I know you've done a lot more qualitative research than me and others as well. But for developing an interview guide, I think it's really important to start with your larger evaluation questions and the broad areas of knowledge that you're trying to hone in on. And so, once you have a general focus for your qualitative evaluation, you want to think about like who the respondent is. So, and what's their unique experience or expertise that you're trying to pull from. So, the specific questions that you ask, like someone delivering the training, would be different than those that you would ask of someone participating in the training. And you just want to think through, like, how can I focus this question to really pull from their knowledge and experiential base. Another tip is to ask how questions rather than why questions, just to help you get at stories. I think you want to ask open-ended questions in qualitative work, and you want to pull people's accounts or stories of their behavior. And so, for example, how did you come to join this group, I think is a better question than why did you come to join this group. And then, when you have your big picture questions thought through, you also want to think through specific probes to elicit more detailed responses. So, and you may or may not use them, but some people just lean more towards very brief answers. And so having some follow-up probes can be helpful. I mean, you can also rely on things like, oh, that's interesting, tell me more, that are more generic. But, think through some follow-ups can help you really drill down as needed based on what people are telling you. And then I think it's also helpful to organize the interview guide. So thinking through like a nice warm-up question that kind of can help to start build rapport between the interviewer and interviewee that someone can answer easily. And then, kind of think through logically, like what's a natural flow for this line of questioning that'll make this interview more conversational and less stilted. And then I would also suggest putting the more challenging, or if you have like sensitive questions, put those towards the end when there's a little bit more rapport built between the interviewer and interviewee. And then thinking through like closure of, how are you going to wrap up this interview and help the participant feel like they made a meaningful contribution and that it was a successful interview. Okay. So, whether your interview is a focus group or one-on-one interviews, or at some point you've got a bunch of responses to questions and it's, probably text or perhaps it's recordings, but you need to analyze your data. And, ultimately, I think there's a lot of different types of qualitative data analysis, but you're generally looking for patterns and themes within the data that help answer your research questions. And so what's coming up again and again. I would encourage an approach that's really ongoing and fluid and cyclical. So, you collect some data and then you start to analyze it, and that might change your questions some. And so future data collection could be a little bit different than what you started with. And so there's really like this fluid, ongoing process where you're learning from the data you're collecting, and that's informing your ongoing data collection. And so there's like this back and forth between data collection and data analysis. But then keeping
Yeah,
Yes,
I couldn't agree more, Louis, with the need for that cyclical, ongoing analysis.
yeah,
And you may need to go, you may want to go back and interview people a second time because you didn't ask them the right questions. And to me, the more unusual and novel your research situation is, the more likely you're going to find out things you didn't know, and you're going to need to go back and interview people a second time or reconsider things. So I like your emphasis on the cyclical process.
yeah. Thanks, Thomasina. And of course, as you're doing that, you want to keep the study's purpose in mind. So you don't necessarily stray from your primary goal, but how you get there changes some in your lines of questioning. Okay. I think it's also helpful to think about like, you're identifying themes and patterns in the data, and maybe your theory of how things are working is emerging. And it's important to think about like, where are the deviations and where's what's coming up that doesn't really fit what the patterns and themes that you're seeing, and what's behind those atypical responses. I think that's important to look out for and explore. And then look for the interesting stories that emerge from the data, and what do those say about the broader study questions. And yeah, as we talked about before, it's this cyclical process. And so, based on the patterns and emergent themes that you're identifying, what other data does that suggest needs to be collected? And, do you want to do that in this context of this current evaluation, or there's always more questions for another date as well. So you got to cut yourself off eventually. Okay, so that's it for qualitative data. And I wanted to talk about evaluation report use. This is not something that you should think about after all your data is collected, but really want to think about it on the front end. Because what's the point of doing all this work if you're not going to use it? And so I find the report is really helpful for starting a conversation with people that you value and want to have a conversation with about your program or training. And there's kind of two audiences that I tend to think about. One is the people implementing the training, so that they're the ones that are going to make process improvements and changes in what they're doing to have a bigger impact. And then, of course, there's the stakeholders whose support you need, whether those are funding agencies or other community partners. And so, think about who you're trying to reach with the report, and maybe you want different reports for different audiences. But, certainly think through, like, once we collect this data, who do we want to share it with, and what kind of conversation do we want to have with them once we share it? The feedback to the implementation team, I think, is you should always do this, because they're the ones that can benefit so much from this evaluation work. So it's really part of like an ongoing continuous quality improvement cycle. By giving the implementation team the feedback, often they're involved in the data collection. And so if they see its utility, they're more likely to continue doing a good job with the data collection itself. A lot of the times you can, keep collecting evaluation data, and it might be that you have a report template that you draw from on a quarterly basis, or some other time frame that you plug that data into, and just use it to start a conversation about, well, what can we do better? Here's the feedback we're getting. What do we want to change? And I've seen a lot of good come out of that type of ongoing. We're just taking the time to think about what's going well, what can be improved, how can we make improvements. This is a little bit tangential to peer-led interventions, but we've used this successfully with the coalition checkup. So, these are also volunteer-driven groups where they do an assessment of what's going well and what's not going well in terms of their operations, and then based on the feedback report that they get, they try and pick one area that they want to work on improving in the future, and then they develop an action plan for improving that particular area, and then they do the assessment again, and they get to see, did they make an improvement in the area that they focused on, and is there another area that they want to focus on next time? So I think that general concept applies here, of like creating the cyclical process where you use the data to think through program improvements and then assess again. So that's the implementation team. And then there's, of course, your organization has plenty of other stakeholders that can find this information useful. You might think about doing a presentation at one of their meetings, or just sending them a report, but trying to start a conversation with them about how they can be more helpful, or just to help get their buy-in in terms of what you're doing. But think through, like, if you're creating an evaluation report that's going to reach them, like what do you hope they get out of it, and how can you use it to start a conversation with them? Okay, so that's it for my content. We have 17 minutes remaining. And I don't know that we have time for thinking and sharing, probably not pairing. So, I'm wondering if it would be helpful if I gave you guys 5 minutes or so to, think through an intervention you're considering evaluating. Think about the evidence that you already know exists about the activity or the area, and then what you might be interested in collecting from an outcome perspective or quantitative perspective, and then also what you might be thinking in terms of process monitoring, and there's qualitative data that you think could be helpful. And then thinking through like who you might share the evaluation findings with, and the kind of conversation you'd want to have with stakeholders. So if you'd like, I could give you guys 5 minutes to think about those answers to those questions, and then we could come back, and I'd be happy to, hear what people thought of, and, we could just talk about it. And so would you guys want to reconvene at, well, it'd be 2:50 Central Time? Or I can also just take questions. You guys have questions right now.
I have a question about measures. So you
Yes.
said that it's a good idea to kind of do a literature review and find appropriate measures. Can you talk about what validity means and how you might evaluate? Like, I guess I have a sense, like, having read of a lot of measures, I'm like, that doesn't seem like a good measure, like, or I can't, so I'm sort of doing something very gut feel. Like, what are you looking for in a good measure?
Yeah, so I think there's a number of issues to consider. If we're talking about like survey research, I always want to see the items. I don't care what you call your measure. I want to see the items, and I want to see if they have like face validity, or are they getting at what I think I'm trying to get out in the evaluation, and does that seem to line up? That's kind of like a step one sort of assessment for me. But then, of course, you also want to look at the past research that's been done on a measure. If it's like a measure of a short-term outcome, has it previously been linked to longer-term outcomes that you're hoping to reach? And does it seem to be related to other similar phenomenon that are relevant for your program? So just looking at see how it's related to other measures or outcomes that are of interest is one way of assessing. And then you can look and see how popular it is. Like there's some measures that are so widely used. Those are at least safe in the sense that like other people aren't gonna criticize your choice of a particular widely used measure because it's just it's been used effectively. You want to pick something that's sensitive. I think that's another thing to think about. Like, are we really going to see change? Is it realistic to think we can see change on this particular measure from baseline to follow up on our evaluation? And so, measures that have been successfully used in similar interventions and they've found outcomes, well, that suggests, okay, this measure is sensitive to change, and it's not, it's not just like some fixed characteristic where you get the same response from people no matter what. That's another thing to consider. So those are some of the, I don't know, off the top of my head, those are some of the key considerations for validity.
Mm-hmm.
Do you have any examples of trying to navigate that gulf that can exist between research and practice, particularly in terms of like data gathering and gathering information that is useful enough to show change in person-centered outcomes without being so intrusive or overwrought that it's very difficult to get a broad number of folks to engage?
Yeah, I mean, data collection is costly and time consuming. So, you could consider having an incentive for completing the time consuming measure. And, you could only, if you've got a lot of participants, you might select a subset of them that you think is fairly representative of the larger group and do a more intensive evaluation work with the subset using incentives, so that they, because you need a high completion rates, and you can spend so much time asking people to complete a survey, but whereas the incentive is often more cost effective, just give them a gift card or small cash incentive to complete the work. You get much better participation response. So I mean, it's a delicate balance, but if you're trying to do rigorous research, the incentives are pretty common. Does that answer your question?
Yeah, it makes sense. I think I'm trying to take this and shift from, okay, I'm not focused on rigorous research and publishing outcomes so much as how can we just be measuring outcomes across our programming more effectively in general, so that we're going less off of it feels like this works and have more meaningful participant voice.
So what's your programming?
This is where it gets complicated. We do everything from residential treatment, clinical services, to supportive and transitional housing. And I have recently taken a position leading the peer services division within our agency, and it's a new position, and we've got kind of a lot of different types of programs that haven't kind of operated strategically together. So we've got this mishmash of different things going on, and I'm trying to figure out how can we create outcomes that are mission consistent, because a lot of our funders' outcomes are very focused on diversion or things that are like meaningful systemically, but not meaningful to a human as much, and also make it applicable enough that folks can use it at a drop-in center or is part of team-based care.
So I often think it helps to start with like implementation quality kinds of measures. And so thinking about what would signify, we're doing a good job with implementation. And, once you have those down, then building out to more of like the participant outcomes. And, of course, start with the short-term outcomes first before you go to the long-term. The mistake some people make is they'll just jump all the way to long-term outcomes without, looking at the details of implementation and short-term outcomes first. So that's one thing to think about.
May I make a suggestion? If you're talking about peer services, the whole basis of peer is that it's based on lived experience. So it's not based on professionals thinking they know what peers are doing. It's based on peers interacting among themselves. Now, there was a session earlier I mentioned today the Survivor Research Network. It's coming out of UK, but these are, and a lot of, I think a number of these people are professionally trained, so they would have the rigorous notion of evaluation that Lewis is presenting, but they have the peer perspective. And I would certainly at least contact them and to see what they have to offer. And instead of just because the research that Lewis is referring to has mostly been done by professionals, and it has a professional orientation, not a peer orientation. So that's my suggestion.
Thanks. I will definitely check out that recording. 'Cause, yeah, it's that exact space of how do we tell those stories, but also create ways of getting the data that, like, I've been on the receiving end of some of these services and surveys and hate it. So how to make that a more relational interaction.
I think qualitative approaches are really good at that. It's more relational, and you can get some really rich stories. And I think those stories can, as I mentioned, are really powerful, both for sharing with stakeholders the success stories, and those success stories can be helpful for recruitment too. But then also, all kinds of things come up that really inform, like, well, here's some issues and challenges that we're facing. What can we do to make improvements here? So I think, you can bring that qualitative data back to the people doing the implementation team and think about, how do we address some of those challenges? So definitely there's a lot of value in that approach as well. Do people have other questions, or, if they have answers to some of these questions that they'd be willing to share with the group if you're thinking about evaluation of your own? I'd love to hear some of the evaluation work people are considering doing.
If there's no other examples, I will continue to take space.
Yeah, absolutely.
The evaluation method that we're starting to look at implementing is thinking about recovery journey and milestones along the way, and building that in a way that, from a qualitative perspective, people are very much able to choose what's important to them and what their milestones are. And then from a quantitative perspective, we'll just have that, number of milestones reached along the way, provide some form of change ruler, somewhat similar to like a motivational interviewing style intervention, to get it somewhere connected to being evidence-based without getting us into some of the more set, this is what this milestone looks like, this is what this milestone looks like. It's very person-centered in that way. I'm just not sure how that'll wind up ending up or looking.
How it'll end up what? Oh, how it'll end up looking?
Yeah, we haven't fully implemented it yet, so I don't know if we'll get meaningful data out of it. But if there's any kind of thoughts or feedback on just how to approach kind of that balance, if it seems like it's worth continuing down that road.
So I've done some related work where we looked at organizations' goals and whether they were achieving those goals. And of course, all the organizations were setting different goals. And, it gets you, I think it's still worthwhile, because you still get a sense of like what percentage of goals were met. And, you can try and look at like the rigor, or the difficulty of the goals that are set, because obviously an easy goal is going to get met more often than the hard goal. But you can look at that as well, and you can talk qualitatively about the different goals that were set and the extent to which they were met. So I do think there's a lot of value in that approach. It's, you know, it's not one I've seen in like a randomized trial context, but I still think you can do some really neat analyses with that kind of data. Well, we're running low on time. Are there any final questions or comments or anything people want to share?
Hey, just real quick, this is Brian at Share. We are coming close. So the next presentation is going to be at 3:15. So if you do have any questions or anything you'd like to bring up, please do it now. We can stay in here a little bit longer, but you know, people may want a little bit break for the next one. Thank you so much, Lewis. Let me know if I can do anything. We are going to have the videos available next week. You go to the Share website. I'll also post that in the chat so you have it. Also, we do have a certificate for attending presentations. If you'd like to have one of those, please email me at brian@shareselfhelp.org. I'll also put that in the chat. And thank you. I'll let you guys continue until wrap up.
Thanks, Brian. And I forgot I had a next step slide. Other things to think about. There's evaluation capacities you might want to develop within your organization. So thinking strategically about that and which ones you want to develop and which ones you want to skip. Think about how the evaluation can support future grants and sustainability of programs is important. And then, of course, you know, as you draft evaluation plans, you want to share that with the implementation team and other stakeholders and people involved in the groups to, you know, make it a more informed and inclusive effort that's, you know, reflective of the interests of the people that might be going through your training or services and other groups as well. So that, you know, there's a lot of perspectives to balance in this. And then if you want additional readings, I think the Community Toolbox is a nice free resource. And I put links to a few of their chapters related to evaluation. So thanks, guys. Appreciate all the feedback.
Thank you.